Okay, so you are experiencing some lower back pain, maybe severe, maybe mild. I would say really pay attention to how you're feeling in your body and do what you can with what I'm about to show you. If you are in a lot of pain, maybe just do the beginning of this and start strengthening when your pain has decreased a little bit. If you're just experiencing some mild discomfort, definitely strengthening is going to be the key component to getting your lower back feeling better and to minimize the chronic aches and pains that you're going to feel with it. So we're going to start with a back extension exercise. When you're having lots of lower back pain, side lying in this position, getting up and out of bed or from a laying down position anywhere really is the best thing to do. Not to just try to sit up, because that's really hard on the back. So side lying position, using your elbows and your shoulders to brace yourself is a really good idea. In this position, I'm going to be laying on my stomach. I want you to pay close attention with yourself as to very minimal details, but they're important details. Your feet don't have to be together. Your feet can be wide apart. It's actually better if they are because it takes the pressure off the lower back. You also want to bring your pubic bone, which is in the front of your pelvis, up towards your belly button so that it creates space between where the sacrum is, which is this bone that we have, this little V that sits in the back of our pelvis, and it brings it down so that it creates a little bit of space. This may be it for you. This might be your back extension. I'm going to show you. This may be it. Put your hands over top of each other like so. Put your forehead on your hands. Bring your shoulders down away from your ears. This may be your back extension, which is fine. If you want to go further, what you're going to do is you're going to bring your elbows underneath your shoulders. Okay? Very important. Your shoulders are braced. You're not collapsing in on itself. You can see the difference between that, right? Your palms are on the floor. And my positioning of my elbows is I'm slightly actually tractioning them towards my feet, believe it or not. So I'm tractioning this way, okay? And my upper body is moving into this trajectory. So not this. That's going to mess up your back. But if I'm moving into this direction, I know it's very subtle. Okay, I'm tucking in my chin a little bit, strengthening my neck as well as I'm here because I'm holding up against gravity, and I'm creating space in my lower back. So I am pulling my pubic bone towards my belly button, my elbows I'm pulling towards my feet, and I'm creating space in the lower back. Okay? The way you're going to come out of it is just nice and gentle. Don't collapse into your shoulders. You're just going to rest. That's a really good exercise to do if you have a herniated disc bulging, or kind of degeneration happening in the back, and you want to just create a little bit of mobility in the back and space, because that's what's really going to help you heal that area of your body. Now back to strengthening. All right, so strengthening is important to do. You have to be diligent with it. You have to stick with it. And this might be a thing that you have to do for yourself so that you can live a really good quality life. All right, we're going to start with easy, and then we're going to progress to a little bit more advanced. We're going to be laying on our stomach like so. You can support your head with the pillow if you have to, okay? We are going to raise one leg off the ground, but it's important not to do this, okay? The hip, this part of our body right here, stays on the ground. So it's a very minimal movement, okay? Watch my leg. That's it. That's it. Okay, now the other side. One side might be better than the other, but your hip bones stay on the ground, okay? Now, you can do that a couple times. Go slow. I did it faster for just video purposes. You can also incorporate your arms. So what you would do is you would rest your head so that you're not messing up your neck. You're going to lift up your left arm and lift up your right leg. Okay? Remember that pubic bone is going towards your navel. Get everything. See, when we do that, and now you do the other side. Sorry, I forgot to mention that. Right arm, left leg. And you're going to alternate that as much as you can. Now, if you want to do it more advanced, you're going to go on your hands and knees like so. And you're going to do the exact same thing. So we can do one leg at a time. But do you notice how my hip wanted to come up? We don't want that to come up. We want it to stay level. Bring it in. Let's try this side. This side did better. This side did a lot better. Okay. So keep in mind, right? We're just bringing our leg back. We're not rotating. But if you want to take it to the other, like, more advanced kind of stage, right? Keep your balance, engage your core, bring that pubic bone towards the navel. That engages the transverse abdominis, which is what holds it all in, okay? Other side. Okay, so this is something that you work your way up into. You start with just laying on the floor, one leg at a time, other leg. Do that for a couple of days. Maybe repeat it, I don't know, 5, 6, 7 times. The key sign is that if it starts to fatigue, and that means if it starts to get really tired and pain, stop. Then you try it again the next day. Maybe you alternate days. I don't have the exact answer as to what you should and shouldn't do, because it's really depending on where you're at with it, right? Don't forget to lift properly. So that means not lifting with your back, bending your knees, bending your hips. Strengthening the legs is also very important to keep a strong base, right, for your body. So repeat this, repeat this, repeat this, repeat this. Put it on a piece of paper, hang it on your mirror. You're going to do this every second day. I would start every second day and do it, and be diligent and consistent with it, and you'll see the results. Good luck.